afternoon, everyone. Thank you for responding. A lot of times people don't, right? I'm thrilled to be here. I want to thank Dean Galea. Great to see you. Thank you for having me. I stand here in front of you today as a child of immigrants, first-generation college student, and I recognize my privilege, and I'm going to talk about how I'm using that in my role as chair, and I'll share a little bit about some stories of some things we're doing at the Bloomberg School of Public Health. A little bit of context for our efforts. In several years, about 2017, 2016, we have a new dean at the school, Dean Ellen McKenzie, who came in and released a new strategic plan for the School of Public Health. And I was privileged that she asked me to be part of her cabinet, and I was the vice dean for faculty at the Bloomberg School of Public Health. And I don't like to say lots of, I was first this or first that, but it's important to name those things and to acknowledge that there needs to be a first in order for there to be second and third and so forth. And so I'm proud to say I was the first Black faculty in the dean's office. And part of that effort, Dean McKenzie also created a office of what we call IDARE, which emphasizes inclusion, diversity, anti-racism, and equity. So you'll hear me use that acronym today, just to sort of be more succinct in my language. But within that process, there were a number of areas identified, including an inaugural dean of IDARE, and this was right before the murder of George Floyd. So you can imagine somebody coming into that space and then amplifying the work based on what we were seeing across the country. In addition, there was a strategic plan that was developed with a lot of community engagement, input from faculty, staff, students, alumni, to come up with those priorities. And I'm privileged that I was involved in those efforts to really engage with faculty. And I'll share with you a little bit about how I've taken that momentum and those goals and have implemented them at the department level at the Bloomberg School. I'm a policy person, so for me, when I think about institutional policy, I'm thinking about formulation. How do we develop policies that are grounded in what we know works? How do we take risks sometimes, because we don't always know what works, and sometimes we need to be innovative and try some things. I think about adoption and also implementation, because we know without solid implementation, our policies fail, and then importance for evaluation and monitoring. So that's a little bit of where I'm coming to for these comments today, but I'm going to focus on the department. So the Department of Health Policy and Management has been around for over 100 years, and it was one of the initial departments at the school when it was founded. And it is one of the largest departments, depending on who you're asking, it's either the third or the fourth largest department. And I have the privilege of being the first Black chair at our School of Public Health. And you might be saying, my gosh, Keshia, it's 2022. But it is a fact, right? And it's long overdue. So I made a choice to start my chair position during Black History Month, even though I was still dean, and I did both for several months, but it was important for me to start at that time. It was significant. So I started that position February 15th this past year, and my department has over 90 faculty and staff and almost 400 students. And why I mention that is to say that as I'm leaning into my work related to IDARE, there's a lot of people that I'm moving along to, right? So when I decided to put my name in to be chair of the department, I laid out a clear vision during my interview process, and that was for our school to be a leader among schools of public health, amongst the university that is leaning into IDARE and its faculty, in its scholarship, and how we center staff and community. And I laid that out, and I said to somebody, this will either resonate or it will not. I'm assuming it did because I'm standing here today. Or maybe it didn't, but it resonated with certain people, which is why I'm here today. Either way, people know that as a leader, this is a commitment that I have, is to advancing the principles of inclusion, diversity, anti-racism, and equity. So I want to just give you a few examples of the kinds of things that we're doing. I'll provide a little bit at the school as well, from my time when I was in the dean's office, and also what I'm doing at the department level. So as far as the school level policies, one of the changes that was made in terms of institutionalizing IDARE and its commitment is that every one of the 10 departments had to name a director, associate, or vice chair for IDARE to be somebody who was leading those efforts at the department level and working with our dean at the school level. When I was in the dean's office, we also standardized the search process. I built on my predecessor's work where we have diversity advocates in every single department, and that person is sought at as an expert and provides implicit bias training, reviews the job descriptions for faculty searches. One of the things that we also ended up doing was that every single search, every candidate has to have a statement of their commitment to IDARE and beyond just, I care about this. It has to be something meaningful and substantive, and the search committee has to be trained with how do you evaluate that? What do you do with that information? One of the things I'm really particularly proud of and relates to some things we heard about today, which was how do we think about this work in the promotions and appointments process? And one of the things that we have at the school is a practice portfolio that we spent the last couple of years working with a colleague of mine, our dean, one of our deans for practice, to update that practice portfolio, where as part of your promotions packet, you lay out the kinds of things you're doing to advance practice. So it's your scholarship or practice, you have your papers, but I'm talking about the doing of the practice, the work that you're doing to work on that report institutionally or internally related to IDARE or related to DEI. Those things can be part of your packet. It goes to the Appointment and Promotions Committee. You include your narrative, you talk about the impact. Somebody said earlier it was about impact. Like, this is about the impact of that work. And so I'm thrilled that we are, that's codified and there are guidelines for how to do this, and the committee that oversees promotions and appointments knows how to look at those as well. At the department level, I was really excited to step in as chair earlier this year, and before I did that, I was really was able to help support the person who was stepping in to be our IDARE lead in the department, the associate chair. We've also, since I've stepped in as chair, moved forward with creating different policies related to supporting anti-racist pedagogy and also inclusive excellence. We heard a bit about that from my colleague earlier in terms of what they're doing at their institution, similar things in our department. We also found that we needed to do more to change the culture. So we have been centering IDARE in our joint department meetings every month. We created a new process for confidential reporting so that people didn't always feel comfortable. We have a lot of work to do. Our staff are skeptical of efforts that were maybe believed to have been done without authenticity, without an authentic emphasis. And so I'm working on that, building trust with the staff, and the confidential reporting is, I think, a critical part of that. In the introduction, it was mentioned that I also have the privilege of directing the Health Policy Research Scholars Program, and why I mention that is as we think about educational policies, I'm looking towards that program to see, are there strategies that we can promote to institutions regarding funding, stipend, mentoring, other supports that we provide to students in that program to help them be more successful. Because that program is designed for doctoral students from historically marginalized backgrounds who are either from various disciplines who are oftentimes the only fill in the blank at their institution and looking for community, looking to be supported. So we have resources to provide to them. So as I wrap up my time and we move to the panel, I want to share just a few things I've learned throughout this journey in terms of policy change. One is I think it's critical to name what we're focused on and to really be specific about it. Is it DEI? Is it anti-racism? What are we focused on? And communicating a clear narrative and vision for where we want to go. I also think it's critical that we challenge those existing policies that are steeped in colonial white supremacist culture. Again, naming those, identifying those, and seeking to dismantle those. I find it incredibly helpful in all of my policy work to identify those policy champions and identifying our white allies in this work. I'm at a predominantly white institution, and certainly voices of many people are critical to the efforts. Also want to highlight the importance of centering voices from scholars, communities, students of color, and people from historically marginalized backgrounds. Again, having a seat at the table. And if there's not an opportunity for them to be at the table, be sponsors. Those of us at the tables have a responsibility to lift up voices of individuals who are not at the table with us. I want to emphasize the importance I've also learned of collecting data so that we can monitor and evaluate our supports and hold ourselves accountable. I also want to share the importance of prioritizing self-care. This is hard work. It is tiring work, and it is absolutely fair for us to make time and space to take care of ourselves while we are continuing to fight the good fight to advance inclusion, diversity, anti-racism, and equity. And then finally, I think it's critical that we imagine a better world. What do we want our institutions to be? What's the vision for that, and how can we lean in and develop policies that can help us achieve those goals? So thank you very much. Here's my contact information. Happy to answer questions later. Thank you.